We have talked a lot about violence this summer, and we've spoken with victims, neighbors, law enforcement, and community activists.
But this morning in Health Watch, we talk with a group of first responders that you may not have heard of before. Fox 12's Marilyn Deutsch introduces us to some medical detectives searching for the facts and evidence behind the violence.
This is where the first meetings between these medical detectives and victims of violence usually begin, in the ER.
We see a lot of sexual assaults and domestic violence, elder abuse, child abuse, sexual assault, human trafficking.
These medical detectives are called forensic nurse examiners, and you're looking at the evidence of the crimes they usually see. Bruises, gunshots, stabbings.
Maybe we need to do a CAT scan of somebody's neck after strangulation.
They also use special forensic cameras and other tools.
This is a swab dryer. As we collect DNA evidence on swabs, we place them in a dryer.
There are crime scenes on our streets, but victims often have crime scenes on their bodies as well. Forensic nurses are trained to collect that criminal evidence, but they only do so if the patient agrees to it. And while they can help patients report the crime, that also is only done if that's what the patient wants.
It is difficult. I think I've learned that reporting isn't always the best way to heal for some patients.
Sometimes, though, patients ask nurses to collect the evidence and just store it.
Some people want to wait till it's safe, or some people want to just think it over to decide if they would like to report at the time.
Despite these forensic skills, the first priority is treating the patient.
We want to make sure that the person is healthy and that they're safe and that they're receiving the appropriate care.
One of the first things I tell my patient every time I go in is, "You're my one patient. I do not have other patients right now. I am here until we are done."
If the patient wants to go to a shelter or wants some other kind of help, forensic nurses can help with that too. Providence now has a dedicated full-time team of forensic nurses. It's a new model for our violent times. Marilyn Deutsch, Good Day, Oregon.
There are some times when reporting to law enforcement is mandatory. For example, that happens in cases of child abuse or elder abuse.
For more information on forensic nursing, head to the Providence link on kptv.com.